two households, both alike in dignity.
In fair Verona, where we lay our scene.
From rather recent plague bred to new mutiny.
Grand civil actions make civil hands unclean.
From two feuding families, a pair of star-crossed lovers.
Almost take their lives.
And doth utter of 144 pages of strife.
The fearful passage of what ascends their parents' rage
is now the 5-minute traffic of our stage.
This is the story of Crabmeo and Julie Lice.
Follow us as the lovers face a new problem, a villain known as
pubic lice.
Pubic lice, also known as crab lice or just crabs, is a type of STI that lives in genital and pubic hair, or rarely but sometimes in coarse hair such as beards, hair in armpits, eyebrows, eyelashes, and torso. They generally don't live in finer hair, such as a hair on your head. Pubic lice occurs worldwide and aren't known to be present on any other animal apart from humans. According to government statistics, about 10% of the world's population have this infection at any given time. This statistic, however, is predicted to be much smaller than the real number, as most cases are minor or self-treated and are not reported to the government. Pubic lice causes small red areas around the area of infection, sores and itching, but nothing major, although being infected may be a sign of another more serious STI. 3, 2, 1.
The main symptom would be itching in genital areas or other infected areas caused by the lice feeding off blood, and said to be worse at night. Although other symptoms could be a grey-blue coloration on the skin that disappears after a few days. Some people experience inflamed skin on pockets of pustules of pus, while others experience no symptoms. They are visible or just barely visible as shells in the form of tiny grey dots, or lice-like creatures around 1.3 to 2 millimeters long, with 6 legs and a tan grey-white in colour. They are generally slower and smaller than other species of lice and tend to stick to more than one strand of hair. As a result of the small population and size of their bodies, they are often hard to find and may require a magnifying glass in the search. Doctors require a careful inspection of the area before diagnosis. Well, it seems like nothing more than an annoyance at first. Left untreated, pubic lice infections can lead to fevers or other infections. As the name STI suggests, pubic lice is spread through sexual contact, with statistics showing that 80% of infections were spread this way. But unlike other STIs, it is also possible for it to be spread through merely close contact, for example kissing, hugging, or sleeping in the same bed with an infected person, as the infection can live on articles of clothing or articles such as towels and bed sheets that have come in contact with an infected person.
Having multiple sexual partners can add to the risk of getting pubic lice. Just to make it worse, as crabs are able to be spread through other articles, using a condom doesn't help. The only prevention technique would be knowing your partners well. It is unlikely to be passed from something that has a smooth surface, like chairs or toilet seats.
A safe and effective treatment when used correctly is a lice-killing lotion available at any pharmacy without needing a prescription over the counter. Other methods include Lindane shampoo, although it should be only used as a last resort as it can cause damage to the brain and other parts of the nervous system. This is typically only recommended to patients with allergies to other medications or have found other medications ineffective. It should not be used on premature infants, people with seizure disorder, or women who are pregnant or breastfeeding. Melicillian lotion is a prescription that is said to be effective but damaging to the health. Petrolatum ointment is also known to cure pubic lice in the eyebrow and eyelash area. It is, however, only available by prescription. Take note that having close or sexual contact with a person in the middle of treatment is just as bad as contact before treatment.
2 is to follow the instructions on each individual package, where they generally consist of
1. Wash infected area and dry with towel.
2. Follow instructions on label package and remove medication according to instructions.
3. Nits may be removed with fingernails or by using a fine-tooth comb.
4. Wear clean underwear and clothing after treatment.
5. To avoid reinfestation, wash all clothes and bedding material you have been in contact with in the past 2 to 3 days. Machine wash with water of at least 55 degrees Celsius and dry in a hot dryer cycle on a machine.
6. Seal items which cannot be laundered and dry clean in a plastic bag for 2 days.
7. Treatment should be repeated in 2 to 3 weeks, as some medication don't kill lice eggs.
8. Inform everyone you had close or sexual contact with to get checked for pubic lice.
9. Symptoms may take a week to settle after medication, so see the doctor if you still have the symptoms after the 1-week period. Tips to remember.
created using Powtoon.